Okay, we next have an update on the coronavirus, and we have Dr. Gloria Addo-Ayensu, who's the director of the Fairfax County Health Department, as well as a number of folks from her team. And obviously this is a changing situation every minute, but we thought there'd be an opportunity here to raise some awareness with the public who may be watching, and also to answer members of the Board of Supervisors questions about what we're doing to help combat this virus. And I will say that I was happy to join our team, and I see a lot of familiar faces here from Sunday at a press conference that we had in the city of Fairfax to raise awareness with the public about what efforts are being undertaken by Fairfax County, by the Commonwealth of Virginia in particular, to combat this virus. And judging from the press reports that have occurred since then, we are getting the word out, important word out, most importantly that people not panic, and that people practice good daily hygiene practices, including washing hands, covering coughs, and that people who have symptoms that they may think are related to this to stay home, and including a good message from our schools about the importance of having kids who are feeling symptomatic to stay home as well. And so there's a lot of important information out there, and as I reminded people at the press conference, Fairfax County is a good source of reliable information for people to refer to. And unfortunately, there is a lot of misinformation out there, and the more our public can adhere to Fairfax County's press messages, our Fairfax County public schools, and the information that they're putting out, and practice good hygiene and not panic, we will get through this challenging time. And with that, I want to turn the microphone over to Dr. Gloria. Welcome.
Thank you. Good morning, Mr. Chairman and members of the board. I'm Gloria Addo-Ayensu, Director of Health, and I'm joined by my colleague, Dr. Ben Schwartz. He's a medical epidemiologist and Division Director of Epidemiology and Population Health at the Health Department. We will tag team for this morning's presentation. We appreciate the opportunity to speak to you about the ongoing outbreak of respiratory illness caused by the novel coronavirus. We will share what the county is doing to respond to this public health threat, and what we all need to do together as we move forward to protect ourselves and family and limit the spread of disease in our community. The virus which causes the disease now called COVID-19 may be new to us, but the Health Department and the county's response to this virus is not new. In fact, we have been preparing for a global outbreak of disease such as this since the county published its first pandemic plan in 2006. At that time, we were dealing with the threat of another novel virus, the highly pathogenic H5N1 avian influenza virus. And although that virus did not cause a pandemic, we used that plan successfully for the 2009 H1N1 pandemic. Since then, all of the work we have done as a county to build continuity of operations, develop HR policies and workplace guidance to reduce the risk of disease transmission, and to strengthen public health preparedness infrastructure has positioned us well to respond to this expanding COVID-19 outbreak. As you know, the Health Department responds to infectious diseases every day. The work we do quietly behind the scenes each day to prevent the spread of diseases like measles, like whooping cough, like norovirus, TB, meningitis, and so forth. It's the same work that we're doing for this COVID-19. We respond to infectious diseases with a layered and phased approach, and we'd like to describe our work as more like a dial versus an off and on switch. So what you'll hear today is the Health Department turning up that dial in collaboration with the Virginia Department of Health, many county agencies and partners like the healthcare community, schools, businesses, community organizations, leaders of our diverse ethnic communities, and places of worship, and so on. As we prepare to see more cases in our community, in our Fairfax community, the health department is engaging these partners to provide guidance and support their efforts to plan for the various non-pharmacological interventions that may have to be used to limit the spread of disease and minimize the potential impact of this global public health threat on our community. There is no specific treatment for COVID-19, and until a vaccine is developed, it's going to take all of us doing our part to limit the spread of disease and keep our community safe. Every resident has the responsibility, as the chairman said, to practice good respiratory and hand hygiene and stay home when sick. We are counting on everyone to cover their coughs and their sneezes. And the best way to do so is by coughing into your sleeve and not in your hands. So we want people to cough like this. We are also encouraging and counting on everyone to wash their hands frequently. Hand washing with soap and water for 20 seconds is the most effective way to remove germs from our hands. And if that is not available, then another alternative is to use a hand sanitizer that has at least 60 to 90% alcohol in it. But if you're given the option of soap and water and hand sanitizer, the best option is soap and water. It is especially important to wash hands after going to the bathroom, before eating, and after coughing, sneezing, or blowing your nose. And lastly, we encourage everyone to stay home when sick and keep away from others as much as possible. If you have symptoms of fever and cough, stay home at least until 24 hours after the fever is gone. These are simple actions that everyone can take, and yet we continue to have many diseases spread within our community because we don't do a good job of practicing these very effective infection control measures. So I urge all our residents to commit to do their part. A healthy Fairfax begins with you and me. And now I'm going to ask Dr. Schwartz to provide you with an overview of COVID-19 and what is going on to respond to this incident.
Okay. Dr. Schwartz, welcome.
Thank you. Thank you, Mr. Chairman and members of the board. Do we have the slides? Yeah. Great. Okay. What I'd like to do is to talk about COVID-19 and the Fairfax County response. I'll begin by providing a disease overview, briefly summarize the international and domestic situation, and then move into what we're doing for pandemic planning and preparedness and highlighting the response here in Fairfax County. I have to emphasize that the situation is changing every day. This presentation includes our best current knowledge, and as information changes, we'll provide updates. And I know that Dr. Gloria has updated the board on several occasions. There are a number of different coronaviruses. Some of these are just common viruses that cause the common cold, and they have circulated among people for many, many years. But occasionally a new coronavirus emerges from an animal reservoir, and that new coronavirus can cause severe disease. Already this century, there have been several emerging coronaviruses, including SARS and MERS, and now most recently COVID-19. These viruses are spread through coughing, sneezing, and close personal contact, and symptoms begin 2 to 14 days after exposure. This new coronavirus was first recognized from a wild animal and seafood market in Wuhan in central China in December, and the virus most likely originated in bats and then had an intermediate mammal host, which is thought to be the pangolin. and COVID-19 stands for coronavirus disease, which emerged in 2019. So the outbreak began in December. It was first recognized globally at the beginning of this year. 3 weeks later was the first U.S. case, and then the first community transmission in the U.S. in late February. So things certainly have been progressing rapidly. There are now over 100,000 people around the world who have been sick in over 100 countries. Almost 80% of the cases have been in China, but the greatest increase now is occurring in Iran, in Italy, and in several other European countries, France, Germany, and Spain. In the United States, we've had almost 500 cases, with local community spread in Washington State, in California, New York, and in Florida. In Fairfax County, there have been 2 cases, both of them residents of Fairfax City, and they are associated with international travel and household contact with each other. There is no community spread that we know of currently in Fairfax County. So globally, you can see the rapidity of the spread to over 100 countries, and there are travel warnings and travel advisories for China, Iran, South Korea, Italy, and Japan. Globally, it's spread widely. In Africa, there are a few countries that have had documented coronavirus disease, but whether this is absence of evidence or evidence of absence, I think is still unclear. Whether or not we call it a pandemic, the global map certainly speaks for itself. For most people in the United States, the immediate risk of being exposed to the coronavirus is thought to be low because this virus is not currently widespread in our communities. However, in locations where community spread has been documented, there is an elevated risk of exposure, as well as an elevated risk among healthcare workers, close contacts of patients, and travelers returning from international locations that are affected. So how does COVID-19 spread? That spread is mainly from person to person through respiratory droplets that are produced when someone coughs or sneezes, and those droplets are larger droplets. They don't remain suspended in the air. They don't move through ventilation systems. They'll drop out of the air due to gravity and only travel less than 6 feet. So that is our magic distance, is if you're more than 6 feet away, there's very little risk of spread. There also may be some risk associated with infected surfaces or objects, but it's not thought to be the primary way that this virus spreads. The most common symptoms of COVID-19 infection include fever, dry cough, and shortness of breath. Less commonly, fatigue, muscle aches, loss of appetite. And about 15% of infected people will develop pneumonia and require hospitalization, but the large majority, 85%, have mild illness. COVID-19 kills about 2% of people who have been infected. That's about 20 times greater than seasonal influenza and is comparable to the virus that caused the influenza pandemic in 1918, the most severe in modern history. At highest risk of death are the elderly, people with underlying disease, immune suppression, and there may also be increased risk among pregnant women. One of the questions that we're frequently asked is whether asymptomatic individuals also can transmit this infection. It's unknown how many people have COVID-19 but don't develop any symptoms of illness because we don't test people who are well. But there have been several family clusters that have been reported in the medical literature where it appears that someone who had no symptoms transmitted it to their family contacts. Currently, we believe the transmission by asymptomatic people is unlikely because they have less virus in their nose and in their throat, and they're not coughing or sneezing. But certainly this is something we need to learn more about. So can we predict what is going to happen with coronavirus in the future? Is this going to be a global pandemic that engulfs our communities and our country? And certainly we cannot predict the future, but I think there is a better question than what can we predict, and that is what should we be planning for? And that's what we in the health department, our fellow county agencies, and other partners in the community, and with your support, are doing right now. Can public health measures stop the spread of coronavirus disease? Unfortunately, I think the answer is no. Absent effective vaccine or drug therapy, the measures to stop this disease include isolation and quarantine, social distancing, and personal infection prevention measures. These were highly effective with SARS, but the reason why we could eradicate SARS, eliminate it globally, was that the infection did not spread until several days after people developed symptoms. And so that gave physicians and public health the time to identify cases, to isolate those cases, and to quarantine their contacts. Unfortunately, we don't have that same luxury with COVID-19, where people without symptoms or who just became ill can spread infection, and where infection has spread to so many countries around the world with limited public health capacity. And so COVID-19 is likely to continue to spread. Some of our planning assumptions are shown on this slide. We are assuming that disease will continue to spread globally, that community outbreaks will occur in the United States, and both of those already have happened. And then based on extrapolation from pandemic influenza preparedness, we are assuming that disease will occur in waves, primarily in the spring, fall, and winter, and that in any given community, a wave of disease is likely to last between 6 weeks and 3 months. We assume that up to 20% of the population may become infected, and based on the data we have so far, that about 2% will die. And given what we know of the time it takes for vaccine development and the clinical trials of antiviral drug therapy, these are likely to become available, but perhaps not at the time a first pandemic wave could come through our community. So what I really want to highlight in this presentation is what we can do in terms of containing this infection and also mitigating its impact in our community. Nationwide, a public health emergency has been declared, and CDC has provided guidance to health departments and the public. Surveillance is being coordinated with state and local health departments, and we are all working hard to monitor travelers who are coming from countries where coronavirus is particularly widespread, and making sure that these individuals self-quarantine and don't transmit infection to others if they become ill. A diagnostic test has been developed, and you all know the situation with laboratory testing and the availability of test kits. Vaccine development and clinical trials are ongoing, and nationally we're planning for a potential pandemic. With respect to travelers, those who are coming from China and Iran undergo health assessment, and if they are asymptomatic, they can go back to their homes, but the contact information is being shared with us from the airport, and we're doing active follow-up risk assessment, self-quarantine, and active monitoring of those individuals. Travelers from South Korea, Italy, and Japan receive an exit screening before they leave the country that they're departing from. And when they arrive, they're being given information by Customs and Border Protection and told to stay home for 14 days. So let me identify and share with you what our responses are. And we begin with a containment response. The goals of containment are to prevent the introduction of illness, to prevent community spread, and if possible, to eradicate the infection. The strategies for containment are travel restrictions, individual case investigations, and isolation and quarantine. All of these are very difficult and very resource intensive, and as the number of cases go up, pretty soon we reach the point where containment is no longer a feasible and viable option. And at that point in time, we go to a strategy of mitigation, which has as its goals to delay and slow the spread of infection in communities, to reduce the peak and overall infection rates, and thereby to reduce community disruption and maintain critical community services. And the key strategy for doing so is something called non-pharmaceutical interventions. I'll talk more about that. Agencies and businesses need to do continuity of operation planning, and then vaccine and drugs when they become available. So here is a schematic showing that we begin with containment, we transition to mitigation, and we are still in the containment stage, but rapidly approaching the point in time where we may need to consider mitigation. The curve, the epidemic curve, in the absence of mitigation is shown here in the solid purple, and then what it would look like with mitigation is shown in the hatched curve. And as you can see, what we're trying to do is to shift the outbreak to the right to delay it the time when it affects our community, and bring down the peak, which allows our healthcare institutions, public safety. It allows all of us to more effectively handle the disruption that occurs with the disease in the community. The non-pharmaceutical interventions are the mainstay of our approach to mitigate an outbreak, and non-pharmaceutical interventions can be personal, they can be community, and also environmental. Dr. Gloria has highlighted a number of the interventions that we all need to do individually, including hand washing, covering coughs and sneezes, keeping from touching nose, eyes, and mouth, social distancing, voluntary home isolation, and quarantine. These are common sense measures, but they are not commonly practiced, and so we need to keep emphasizing their importance. More broadly in the community, we can do social distancing, staying 6 feet apart from others, particularly among those who are at high risk, dismissing or closing schools, modifying work practices, and canceling mass gatherings. I'm going to talk more about all of those. And then environmentally, environmental surface cleaning. So social distancing, again, is based on the concept that the virus spreads within 6 feet. Social distancing strategies may include shopping during off hours or buying online, teleworking, limiting face-to-face meetings and doing those meetings via conference call, rearranging school classrooms, and just more generally avoiding crowded places. Dismissing or closing schools is something that many communities are currently dealing with. The rationale is that in influenza pandemics, children have the highest attack rate of illness, and the spread among children often precedes the spread among the community in general. The options for what we can do with our schools include dismissal, where the staff report to work and continue to lead distance learning, versus entire closure. It may be preemptive before disease is in the community or in the schools, or it may occur when a particular threshold is reached, and it could be system-wide or selective. There are a number of factors that may contribute to the decision about dismissal or closure of schools, including the role of children in transmitting this infection, the severity of illness and the attack rate in communities, as well as our capabilities for distance learning. Mass gatherings are likely to be canceled, and you've probably heard about a number of mass gatherings both globally and in the United States that have been canceled already. There may be temporary closure or cancellation of childcare, school, places of worship, sporting events, and concerts. As disease waves spread through communities asynchronously, the decisions on canceling mass gatherings are not going to be made by the CDC, but they will be made in each individual community that is being affected. And so these are decisions that we in Fairfax County are going to have to make based on the status of illness here. So what is the health department doing to respond to this outbreak? We activated our incident management team shortly after the occurrence of the first U.S. case. We are coordinating with federal, state, and local partners, monitoring travelers, as I've already mentioned, conducting surveillance for respiratory illness. We are consulting with providers and giving them guidance on lab testing and contact investigations, providing information and working with our county partners, and preparing the mitigation activities that I highlighted to reduce the impact of a potential pandemic. We are currently working with healthcare providers, EMS, schools and universities, response partners, as well as businesses, so that they can all do the planning that they need in order to mitigate the impacts in our community, and messaging to the public, doing community outreach, and a call center to respond to any concerns by the public. I want to highlight a little bit about workplace and agency preparedness. And one of the things that Dr. Gloria said in her remarks was that we need to encourage people to stay home from work if they're sick. And what I really want to point out is that often we need to do more than just encourage. We need to enable. And so as we think about the types of interventions that we can do in our community, in our workplaces, we need to think of enabling those good behaviors rather than just encouraging them. So we need to enable hand washing, respiratory etiquette, and staying home when sick. We need to review the sick leave policies and ensure that they are supportive of these good practices. We need to enable social distancing through policies like telework or flex time to reduce in-person meetings and travel. We need to support protective behaviors by providing hand sanitizer and tissues, and to increase environmental cleaning of frequently touched surfaces with an EPA-registered disinfectant. I mentioned we're already developing continuity of operations plans, planning for high levels of staff absenteeism, the potential for workplace closures, disruption of supply chains, and supporting the preparedness activities of our key partners. As we do all of this, we need to be aware of our entire workforce, both employees as well as contractors, and those who have physical disabilities, those whose primary language is something other than English, who don't have paid sick leave, or are economically disadvantaged. Frequently, people ask the question, should I be wearing a face mask? And the answer is that if you are well, CDC recommends that you do not need to wear a face mask and that it will offer little protection. However, those who are ill, who are coughing or sneezing, by wearing a face mask, it will trap any of the secretions and keep them from spreading disease to others. At this time, N95 respirator use should be reserved for people who are taking care of patients with COVID-19 because the supply of these respirators is limited, and healthcare workers, EMS providers, and law enforcement have further recommendations for personal protective equipment, and we are working with them, and they are well aware of what those recommendations should be. So what I'd like to end with is by pointing out that in our county, with our policy of One Fairfax, that there are disparities in the risk of illness and in the consequences of a pandemic. People who come from disadvantaged communities live in more crowded settings. They are more likely to rely on crowded public transportation. They are less likely to have jobs where social distancing is possible. They are less likely to have paid sick leave and also less likely to have an easily accessible source of medical care. As a result, illness in these populations is more likely to occur, and there would be more serious consequences when they became infected. Here's a slide showing data from the Bureau of Labor Statistics on the percent of U.S. workers who have paid sick leave. And the average all around the country throughout the entire workforce is about 2/3. But if you look at those who are in the service sector, who are in construction, extraction, and farming, it is less than 50%. So we need to recognize that the ability of a large portion of our workforce to stay home when sick is limited, and that this may affect their ability to adopt these effective community mitigation strategies. There are many resources, including websites from the CDC, the Virginia Department of Health, and our own website in Fairfax County, and a lot of existing or pending guidance that is coming out every day from the CDC. So thank you, and we'd be happy to answer any questions.
Okay. Thank you, Dr. Gloria. Thank you, Dr. Schwartz. A lot of information that's there. And again, for the viewing public, this is the information as we know it now. This is an ever-evolving situation. I know we spent a good deal of time Sunday talking about the individual cases. I think people understand those. I think the most important takeaway here is the things that we can do individually to stop the spread. And I think emphasizing those, we can't emphasize those enough. I know that schools has put out a message, a very long message, and I know there's a lot of concerns on the schools front. I do know that the schools are taking extra time for hand washing activities, are monitoring this very closely. But if you could spend a moment just talking about your interaction with the school system and how that works, because I think that's the question we seem to get asked the most often about schools. And I know that there is a lot of misinformation out there. I had some students last night confront me that they had heard there was a case in their school. And I said, no, we're not aware of any case in your school. And so there is a lot of angst out there and misinformation. So can you spend a moment, Dr. Gloria, telling us about how you communicate information with schools and how we're making sure that what we're messaging out we're on the same page with?
So as you know, the health department has a school health program. So we have a liaison that works closely with the EPI team, and everything we do with the schools. So in 2006, when we developed our first pandemic plan, we did that with the schools, and akin to what we did, they also developed a plan. In the last few months, we've all unearthed our plans, and they have have made tweaks to them, and they have brought their plans back to us for us to review. We talk to the schools all the time. All the messaging that has gone out have gone out with input from the communicable disease team, and we are currently working with them in terms of, for this situation, to develop kind of a framework that we would follow should we need to implement the non-pharmaceutical interventions that we have talked about. It's not going to be an if-then, but create the conditions and the factors that would go into making those decisions. And there'll be joint decisions. Yes.
Okay, thank you. And Dr. Brabrand and Chair Corbett Sanders were at our press conference on Sunday. We had an opportunity to talk, and I think it's important to say on the equity slide that you mentioned, that those same equity challenges, of course, affect our school-age population, and clearly decisions that the schools might make on closing or not, that they're weighing that factor that, closing schools in certain communities have a much larger economic impact and put children in different environments. And certainly, I know we're cognizant of that, and schools are cognizant of that. So with that, I'm going to open it up to board members who have any particular questions. And let me just start this side, and we'll just work our way through. Supervisor Alcorn.
Thank you very much, Mr. Chairman. A couple of questions. And I know many of us have been getting contacted by constituents and had questions posed of us. So thank you. It's a very comprehensive presentation. In the presentation, no community spread we know of in Fairfax County. I have heard concerns that because we have relatively few tests that have been conducted already, how do we know that? How do we know that? How do we know that we're not yet seeing community spread? And I know only time will tell ultimately, but you also mentioned, I guess, conducting surveillance for respiratory illnesses. Is that one method that's being used?
So the health, thank you, Mr. Supervisor. The health department does conduct surveillance for respiratory illnesses, but at this time of year, with many respiratory illnesses in our community, including influenza, we certainly wouldn't be able to differentiate if a case is caused by COVID-19 or caused by the flu or some other respiratory illness. So we do rely on the result of the diagnostic tests, and unfortunately there have not been as many available as we would have liked. The testing now is available at 2 large commercial laboratories at LabCorp and Quest, and so physicians do have the ability now to order those tests at their discretion based on the illness of a patient and their exposure history. We're also continuing to test through the Virginia Department of Health, and then the confirmation of presumptive positives is made at CDC. So we'll probably learn a lot more in the next few days. Obviously, we can't know what we don't know.
Right. That's very helpful. And one follow-up question. So for anybody that is symptomatic, and you mentioned that basically they should wait until 24 hours after their fever goes away. Should they also call ahead to the urgent care facility? Are we advising people to do that before they go in?
We are advising people to contact their healthcare provider before they go in to make sure that they don't expose other people in the waiting room and that the people in the medical office have the ability to put on personal protective equipment if that's advised. We will be doing a couple webinars with the healthcare providers in Fairfax County, both the outpatient providers and the hospital providers, and talking with them about what they can do to remain safe and to be an important first line of testing and defense in this situation.
Good. Thank you very much.
Okay, thank you. Any other questions on this end of the dais? Yes, Supervisor Palchik.
Thank you, Dr. Addo-Ayensu and Dr. Schwartz. A couple of follow-up questions. So first of all, regarding the non-pharmaceutical interventions, I guess it's a little bit unclear to me from the presentation. Is that something that we are currently encouraging or requiring in the county?
So for certain interventions, certainly for the individual interventions, it's important that everyone start practicing those things right now. I've been practicing keeping from touching my face, and I've been watching all of you. So the individual interventions, we do need to make them practices. In terms of social distancing, I think it's particularly important for older adults and people who have significant underlying diseases. One of the things that we've heard is that as you cross age 60 and you keep going up into your 70s and 80s, the risk of mortality almost doubles with each decade of life. And so if you're an older adult, be prudent in terms of your contacts in the community. Certainly, I would advise you do not go on a cruise at this time. And just be aware of people around you and be aware of those personal protective activities that you can do to remain safe.
And so regarding social gatherings, events, some of us have public events coming up. Do you have recommendations for that?
With no evidence of disease in our community, I think certainly continuing those events is okay at this time. It would be great if one can, at those events, tell people how they can protect themselves, recommend that people use hand sanitizer if they have it, that if people are sick, they don't attend the event, but we're not recommending any cancellations at this point. If there is disease in the community, at that point in time, we would then be more forward-leaning in terms of public events.
Okay, thank you.
Okay. Supervisor Stork.
Thank you, Mr. Chairman, and thank you for the presentation, Dr. Schwartz and Dr. Ayensu. I guess I'll start first with our own universe here in the county. We have obviously the additional frequent touch surfaces cleanings. Has there been specific engagement with our facilities management department and the contractors that work on our facilities, and how has that been evidenced?
So, yes, that work is ongoing. Under Dave Raw's leadership, we had a meeting not too long ago where all the county agencies came together, looking at HR policies and so on. Those are all things in the works. And FMD specifically, they've had meetings, and they have actually, I think yesterday, came up with an initial message, but that work continues about frequently cleaning high surface touch areas and so on.
So those are specific instructions FMD have given their contractors, because that's mostly a lot of who cleans our facilities as well.
So that work is in progress, but yes, the conversation has definitely started, and it is a work in progress.
Okay. Is there a tipping point? The conversation about meetings or non-meetings, are you looking at for particular signs where that's likely to occur, meaning that you would recommend there not be mass meetings, or is there some level of evidence of that in the community that would spark that or cause you to provide that recommendation?
So So I can start and you can finish. Obviously, as he mentioned, there's some categories of people in our community that are more at risk. So senior events and so on, if they can be minimal in terms of congregating, that certainly would be advisable. In terms of, and then if there's an alternative, I think this is an opportunity for us to think differently and see how we can do things differently. And so those kinds of things I know being talked about at the county executive office in terms of things like teleworking and different ways and different approaches to how we do our work. It is all part of the COOPing planning that is happening at this time.
I've been reading the literature, and I've seen different percentages about mortality and severity of the disease. And I think part of it is the data that we have from China is somewhat unclear. Is the 2% and 20% that you used, how confident are you that those are real versus they may be less because the incidents, as you were speaking about earlier, aren't as evident. Some people get sick, aren't evident they're sick, et cetera. Mm-hmm. Any just assurance or any kind of level of confidence that you believe that they're associated to the 2% and the 20%?
Sure. The apparent case fatality rate, if you just look at the number of cases that have been identified around the world and the number of deaths, is somewhat over 3%. Mathematical modelers have tried to estimate how many cases are out there that have not been identified, and they've developed what they call an infection fatality rate, the proportion of all of those, the universe of those who are infected who would die. And one of the recent figures that they came up with is 1.4%. So what I can say is somewhere between 1.5% and maybe 3.5%, 2% seems like a good estimate at this time.
Right. Thank you. Thank you very much.
Okay. Supervisor Smith.
So I think the question that's on people's minds is how we determine when we do close schools. And I know there's not a clear answer, but you talked about evidence of disease in the community. Could you kind of explain a little bit more of what that evidence of disease in the community is and how you make those decisions where we really have to start keeping people home?
Let me just respond with a little bit of the epidemiology, and then maybe Dr. Gloria can add something. So with influenza pandemics, one of the things we learned in 2009 with the H1N1 pandemic is that by closing schools, we were able to prevent disease and to delay the spread in the community. So extrapolated from influenza would suggest that early in the course of a community outbreak, once community spread has occurred, we would seriously want to consider that intervention. But at the same time, COVID-19 is different from influenza. And what we know about disease in children so far is that the disease is less severe, and we still don't have a really good handle on whether, like flu, the infection rate is higher in children. And so this is something where we're still hoping to be able to learn more. It's likely that early in the spread of disease in our community, if there were a case in a school or if there were a case in a staff member at that school, that individual school would close. But whether we would recommend system-wide closing or not, I think depends on a larger number of factors.
Okay.
Thank you.
Okay. Supervisor Groves.
Thank you, Mr. Chairman. I think the message here is don't panic.
Yes.
That's, everybody's saying, oh my God,
Yes.
Don't panic.
That is the message.
Follow the good hygiene that most parents instill in their children, although there may be those, because we're a very diverse community, there may be those who didn't have the same lessons that some of us had. I'm probably the only one here at this dais who remembers the 1957 pandemic. I think we called it the Hong Kong flu then. I was in bed for 8 days. I was in elementary school, and I remember being really, really, really sick. You just stayed in bed, took aspirin, drank fluids, and got over it. But it was a huge issue in the community. And we don't want that to happen again. We have a lot more opportunities now. We've better medical care, a whole lot more information than we did way back then. I have on my screen here a flyer that the health department and I guess CDC has put together, Stop the Spread of Germs in Fairfax County, Virginia. Nicely done, short messages. Is it available, or will it be available in languages other than English? Yes. Because this would be very helpful to post in our public rooms and so forth, in all of our government centers. But because of our diverse community, I keep thinking of the AARP tax aid that's going on right now, and the world is there. So it would be very helpful to have these flyers in other languages.
Yeah. Yes, and that work is in progress. We've done a number of informational pieces that are being translated into the top 8 languages in Fairfax. If you recall, in 2006, with all of the pandemic planning, we created a book, a brochure that was sent to all households in Fairfax County. It was like a self-care guide, and that was also translated into the top 8 languages, and we distributed. So we distributed in English to all houses, all homes, but we used our multicultural connections to distribute the other languages and the media and so on. So we're going to be using a similar approach to distribute the informational pieces that we create.
It would be very helpful if you could, once that is available, make sure that all the board offices get it, because we have the opportunity and ability to post them in our own government centers, but also to get that information out. Thank you.
We've also been meeting, if I may add, we've also been meeting with the leaders of our ethnic communities. Very early on, when it was primarily a China issue, we met with them several times to understand what the situation was for them. There was a lot of panic, there was a lot of stigma, and wanted to find out what we could do better. We actually created information for them that was not only broadcast here and throughout the U.S., they actually told us that information, some of the information we gave them was actually broadcast in China, because people in China didn't have that level of information. So we're working with our multi-ethnic groups all the time to gain their feedback and to use them as a vehicle for disseminating some of the information that we're putting together.
One of the things I like about this flyer is that it's very few words. It's a number of pictures, but it's very simple. You can interpret it however you wish. I do wish we could come up with a different. They say you should sing "Happy Birthday" twice to yourself as you're washing your hands. You feel sort of silly doing that, but it is the right amount of time. Maybe we can create some other tunes to wash your hands by. Thank you.
And the simplicity part is very important, because while you mentioned back in the 1950s not having access to some of the information we have now, unfortunately, because there are so many reports out there, so many sources of information, now we are running into the problem of misinformation that's out there too. So if we can get that in multiple language, the simplicity of it is easy for anyone to understand. One of my challenges with some of the things I've seen so far is, while I'm reading it in its entirety and watching the video that came from schools in its entirety as a public official, not many people are going to put that amount of time into that. And so we need to make sure that our messaging is very simple, very easy to understand. It reiterates what Supervisor Gross said about the do not panic element, because we can all control, to a great deal, what's happening here. And so as we move forward, the simplicity of that message becomes really important and becomes much easier to universally understand. Supervisor Lusk.
Thank you, Mr. Chairman. Thank you very much for the presentation as well, and I appreciate that we have professional staff dedicated to working on issues like this, and that you have a plan. That makes me feel a lot more comfortable, so thank you very much. I've got a couple of questions. One is, what is the county's testing capacity for this virus, and under what circumstances will people be tested? And then second to that is, how many have already been tested?
The county laboratory is not currently doing this test.
Right.
Therefore, we are sending specimens to the Virginia Department of Health laboratory, and their capacity is increasing as they receive more tests from CDC. As I mentioned, testing is also available commercially so that any physician who is seeing a patient based on the clinical and the exposure histories thinks that it could be COVID-19 is able to get testing done that way. And all of the commercial test results, both those that are positive as well as those that are negative, are being shared with the health department. I can't tell you exactly how many tests have been done in Fairfax County so far. It's, I believe, somewhere between 10 and 20 with the Virginia Department of Health. But again, more testing has been done through the private sector now.
Okay, that's helpful. I appreciate what you said with regard to the non-English speaking communities and making sure that we're getting out. I do have a concern that many of those folks aren't normally accessing county resources, so we're going to have to be very proactive in getting to them and sharing information so that they're aware of a lot of the things that we've talked about here. So in light of that, and thinking about the point that you made that we might end up having to possibly close schools, and that we recognize that many people, don't have the same levels of sick leave as even some who work here in the county government center, and many of them won't be able to telework based on the type of jobs that they have. What will the county do in terms of resources and services to maybe support some of those individuals? Just trying to get a sense of how we might be able to lessen the burden on them.
So one of the things we did in 2006, and we've been talking about doing it again, if you recall, we had community meetings, town hall meetings, and we also had small business summits. Because at the end of the day, it's the employer who needs to enable his or her staff to take these leave when they are ill. So it was an educational process, but we also telling, as we engage with the public, we also is a message that we're going to encourage. It's going to be hard because people might be willing and ready to do so, but they might not feel like they are able to. But at the end of the day, especially for small businesses, people coming in sick can easily infect everyone in the organization, and then that business shuts down completely. So it almost, is something that people have to think through a bit. And I know in the past, as we had these conversations at the small business summits, and we had lots of small business workshops in our health department and in the community, as we went through these conversations, people got the ahas and were more willing to, I think, go back and enable their staff to stay home when sick.
Yes. I guess what I'm thinking is if there's a situation where the schools are closed and the parents have to be home with their kids, but they don't have the ability because their employer doesn't allow them to take the time off, or they can't take the loss in income. I guess what I'm trying to say is, are we thinking about those who might need some support so that they can stay home with their kids in the event that the school's closed?
That's right. And you bring up a good point. That touches on individual and family preparedness, something we haven't talked about. Right. But even for all of us, as a county, as we talk about cooping and all that, people will not show up or will not be able to come to work if they are ill-prepared. So part of that work, in addition to the personal hygiene things that we're doing, is also making sure that we have plans for these very scenarios. So as we engage with our community, those are messages that we share, and also provide CDC, ready.gov. They have easy checklists that we used in the past that we'll look at again to see if it's still applicable, to help people do some of these basic, at least thinking through it ahead of time, so that if it happens, it's not completely new and unthought of, so that they're unable to do anything. Part of not being prepared is you kind of get paralyzed if it all of a sudden just
Right.
happens, but for people to start thinking about it, talking about it, and so on. When we did our small business summits, for example, in the past, one of the things we gave them were strategies for staying alive, because as you know, if a small business shuts down, any business shuts down for any significant amount of time, chances of coming back online could be difficult, and more so if it's a small business. So in normal times, small businesses might be competitors, but we really encouraged, especially in the ethnic communities, the businesses that came to these meetings, was to collaborate, to work together, and to find ways. So if you are a food establishment that does not have a delivery option, you can partner with another one that has a delivery option, so that maybe if during, when there's high absenteeism, you'll be able to work together to keep afloat. And so these are different ideas that we will be sharing with community, so that they can at least begin to think it through. They might not do everything, but to get their minds going in a different direction.
Okay, I appreciate that response. I have one more question, or maybe it's got two parts to it. First is, what federal resources are we currently receiving, or can we expect to receive, is the first part of the question. And then second, are there any trigger points that could cause those resources to change? For example, if the governor declared a state of emergency.
So we haven't received any federal dollars yet, but we know that it'll be coming down the chain in due time. It always happens for H1N1, Ebola. Eventually, the dollars come, and then through the state, the jurisdictions receive a portion based on a formula that VDH uses to distribute money to us.
Are we proactively talking to the feds and the state right now about this for Fairfax County?
We're not doing it for Fairfax County per se, but when it arrives when VDH gets the money, it's an automatic distribution. They've already started telling us about, thinking about additional resources that we may need, and how to go after those resources and so on.
Right, and VDH was represented at the press conference, and they've been in constant engagement with our health department on that subject, among others.
Yes, we're in constant meetings. Even though we are an independent health department, by all practicality, we're just like one of the VDH health districts.
Right.
They include us in everything that they do.
Right. Okay. Supervisor Faust.
Thank you, Mr. Chairman. Thank you for the presentation. I thought it was excellent, and appreciate it very much. I also think that we typically get a very good, what I'll say, bang for our buck from the health department. And we get you do a lot of great work, never out front in terms of our concerns when it comes to budgeting, but when something unique like this comes up, I hope that we will not hear that we didn't do something because of lack of resources within the department. If you need something, this is important, obviously, and I'm confident that you would step up and ask if you need something, and I'm confident we will make sure you have the resources you need to deal with this issue.
So DMB and county executive have already reached out and about our needs, and are looking to make it possible for us to get additional people on board.
Excellent. And one of the, I guess, two areas where I think resources might be needed, and that testing. We're not doing testing. I think maybe we should be. It's we are the county, and we're at the local government level. There are many people in this county who are not going to go to the doctors and get tested because of the money it costs and just the inconvenience. You can set something up as that we could really, I think, do a good job on the testing front. I understand there may not be tests available yet, but they're coming. So think about that, and I mean, you're the expert, but I think that would be important. I also think that when a vaccine is made available, that we as a county should be either setting up or arranging for mass vaccination. I can remember as a kid standing in line to get my polio. And, you know, I'm not sure that if it wasn't made available that way, I would have gotten it. No, I'm sure they would have figured out a way. But, you know, there's so many people out there that we can help. And just get the numbers. I mean, it's going to be all about getting the numbers, right? Okay. So the meetings concern me a lot. I mean, I'm from two fronts. One is, you know, we're asking people to come together in large groups in small confined areas. So you got that side of it, and then we also have the side that we're not going to get the attendance that we would normally get and, you know, should have in order to do our jobs of providing public forums. So I'm hearing you say that we don't want to start canceling public meetings, that there's no, not that we don't want to, but your professional opinion is that we don't need to at this point in time. And I respect your opinion very much. I mean, I'm going forward as is, but the moment you change that opinion, please let us know, because we all have meetings all over, and it's only going to get worse for the next couple of months because everybody tries to get everything done before the summertime. So please keep us, and I know you will, but let us know when to pull the plug on the public meetings, because there will be a lot of them. I think that's it. I really respect what you guys are doing and how quickly you've responded, and the professionalism that I've seen come out of your department, so thank you.
And can we, on the one question that John raised about testing, I think it's important to share again why someone would be tested and when, because what we don't want to send a message out there is everybody go line up to get tested. I mean, there's triggers for that, and there's reasons why people would be tested. Maybe you can reiterate those.
Sure. Thank you, Chairman McKay. The recommendations for testing are based on the clinical illness that one has, and fever and cough are the hallmarks of coronavirus disease, and then also based on potential exposures. So whether someone has traveled, whether they've had an exposure to someone who had COVID-19 disease, and then also the level of risk for that individual. So people who are particularly high risk, or people who have pneumonia or serious respiratory disease would be advised for testing. We have talked with our colleagues at ANOVA about the availability of testing for people who cannot afford to pay. And ANOVA has assured us that they will do testing on individuals who need that testing without regard for cost. So they will cover the costs where that needs to be done. Also, testing through public health, through the Virginia Department of Health, is done at no cost, and the director of our public health laboratory in Fairfax County, Deb Severson, says that she also is looking at whether they can begin doing testing here through public health.
Just say that word needs to get out. I mean, if you don't have the money for testing and you don't know that it's free, you're not going to get it. But it sounds like you're on top of it, and I appreciate that.
Yeah. And I think, I don't disagree with that. I think it needs to be paired with the first part about why to get tested, because I do get concerned about, you know, people getting tested just to get tested. And obviously, you know, there is more testing kits available, as you've acknowledged, as has been mentioned before. But there are certain circumstances under which people feel like they need to be tested, and not everyone needs to be. And so if someone walks into a county health clinic and presents some of the symptoms that you've just described, how do they get from there to an ANOVA test? How does that transpire? So I think one of John's questions is fine, you know, if you're already at the doctor and you are advised to get these tests, but if you walk into a low-income health clinic in the county. How do you get from that point to being tested if a doctor is recommending that you be tested at the health clinic?
So our Fairfax County clinics would not do testing at the clinic itself. And the reason is that patients who have respiratory disease, perhaps serious respiratory disease, need to be thoroughly evaluated by a physician. And that is not the kind of service that we have at our health department clinics. What we would do is talk with the patient, see if they felt a need to seek further medical care. If not, we may advise that they go home and they separate themselves from others. We would give them the information about covering coughs and reducing the risk to others around them. And then if they became more ill, they may call ahead to an emergency department or an urgent care center and then go in and get tested. One of the things that is, as you say, we need to be aware of is the potential for the worried well to overwhelm the capabilities in our emergency departments and urgent care centers. One of the other reasons why we're talking with our outpatient providers coming up later this week or next week is so that we can make sure that they have the capabilities to obtain the tests and do the testing, kind of spreading the burden out through our healthcare system. And included in that will be our federally qualified health centers, our colleagues at Neighborhood Health and the other federally qualified centers that provide services to the disadvantaged communities.
Okay. Really important information. Thank you. Supervisor Harity?
Yes, thank you very much. Again, thank you. Very, very comprehensive and informative program, and thank you, Dr. Schwartz, for reminding me how hard it is to not touch my face. It is a very difficult thing to do. Is this presentation going to be made available to the public? And so we're going to post that?
I think it's being recorded. Yeah, obviously it's being recorded.
Okay.
And the plan is, yes, to make it available.
Okay, because it's good, because I think it is a very good one. To echo a couple of things, most of my questions have been answered, but certainly to echo what Supervisor Gross said, don't panic, but I'd add be smart to the end of that. Don't panic, do the right thing, because those are the messages that we need to get out. On the resources, I'm sure the county executive is going to let us know if there's anything you need that you can't get, but we certainly want to make sure you're properly resourced for this. You talked about, the two big impacts I see are really the schools and businesses, and Supervisor Luss talked about the impact on business. Do we have any of those small business kind of preparation seminars scheduled yet?
No, this is all being planned this week, but because we did them in the past and did so many of them, we're just going to. Mm-hmm.
Okay.
And we have been in touch with the community. One of the things that we've always done is engage our community. So through the leaders of the community who we convene every quarter, and sometimes more often, the Multicultural Advisory Council and the media that represents ethnic groups, we really have a pulse on our different groups within our.
Yeah, as you get those going, I'd be very interested in helping you get the word out on this, because I think that is important. We get this message into the business community. I'm thinking about it with my own company, so I'm sure there's a lot of CEOs and small business owners that are making plans. Some of them probably appropriate, some of them probably could be done better with your help. And to go to Supervisor Faust's point, I don't think any one of us wants to be hosting the meeting that spreads this disease. So I'll say it a little more bluntly than you said it, but that's what we were thinking. I've got a teen job fair coming up on Saturday, and I'm struggling with it, but I need your help. I don't want to panic, but I also want to be smart. So certainly get the word to us as quickly as we can.
At this time, and as we've said many times, it's an evolving situation. At this time, there's no evidence of community spread, and so.
And there's actually, because of that, there's also a fantastic opportunity to use that event to educate the people who come there
And we are.
about what to do
And
too.
we
And
are
so,
doing that.
so yeah, I mean, I think until we are given a signal that there's some community spread, we do need to make sure at all of our community events that we're coordinating with Dr. Gloria and how to get messaging out to the folks who attend those, because they're force multipliers. You know, people who come to our community meetings, of course, are talking to a lot of other people in the community that we may not be reaching, and so it is a good opportunity for that.
Okay.
Okay,
Yeah.
Supervisor Watkins.
If I could just address that just for a second. I think there are 4 things that we should think about with community meetings. So the first of those is the status of disease in our community. Is there evidence of spread? The second thing is whether the gathering can be held using a different format, for example, a teleconference or a webinar, something like that. The third is attendance at the meeting of people who are at particularly high risk. And is this a meeting for people who are older and may be more at risk for severe consequences of disease? And then the fourth consideration is the ability at the meeting to use protective measures such as social distancing to make sure that hand sanitizer is present at the meeting so that the meeting can be held as safely as possible. So I think if you consider those 4 things, you can make good decisions about whether to hold a meeting or not, and certainly we're always happy to consult with you and provide advice specifically.
Okay. Thank you for that.
Okay, Supervisor Walkinshaw.
Thank you, Mr. Chairman, and thank you both for the presentation. I think to the extent any of us can feel a little bit better about the situation, your professionalism helps us feel a little bit better about the situation. One of the things that struck me in listening to your presentation is how important compliance is. So getting the public to comply with your public health recommendations, whether it's sneezing into your elbow, washing your hands for 20 seconds, self-quarantining if necessary, social distancing if necessary. That's really the key to success here. In order for the public to comply with recommendations from public health professionals and government, the public has to trust us. And I think, you know, we're facing 2 diseases, actually. We're facing the coronavirus, COVID-19, but we're also facing a disease of misinformation that's out there, and the chairman has alluded to that. And you know, this is going to make all of us uncomfortable, but one of the challenges we are facing is that President Trump is lying to people about this disease and about what's going on. President Trump has said that anybody who needs a test will get a test. That might be true here. It's not true across the country. That's a lie. President Trump said just a couple days ago that the overall numbers, the rates of infection are going down. That's a lie. President Trump has said that the World Health Organization death rates, statistics are false. That's a lie. President Trump said that the coronavirus is the Democrats' new hoax. I can assure you that's a lie. The administration is muzzling scientists. They're attacking journalists who report the facts on all of this. And I say this not to make a political point about President Trump, but these lies are different than normal political lies that one might tell, because they undermine trust in you, they undermine trust in us, in public health authorities, and scientists, and doctors, and it makes our role all the more important that we are telling people the truth, even when the truth is bad news. And that's why I want to applaud you all and Chairman McKay for the press conference that you held on Sunday, where people in Fairfax County, and maybe even across the country if they tuned in, got to hear the facts of what's really going on, what we're doing, and what we need to do as a community and as a country. And one of the things I would just encourage you to consider is doing those briefings regularly, so that people are regularly hearing the truth. Whether the news is good or not good, people need to know that they can trust that they're going to get that from us in Fairfax County, because we are operating in a larger context here where people are not getting accurate information from every source. So our role is even more important. So thank you for what you're doing.
Thank you very much, Supervisor Walkinshaw. Excellent points, and frankly, since we had our press conference, what I've heard overwhelmingly from the community is the trust people have in the county's messaging. And that's why I've emphasized everywhere I've gone about us being a trusted messenger. And frankly, I think the public, especially our public, is very suspect of what they're hearing at the federal level already, and they're relying on us. And that's why this briefing was so important, because we have to reiterate that, we're treating this as a local issue, at least in terms of what we're doing in our own community. We have a plan to deal with this. We have resources. We're ready. We're messaging to people what to do or not to do. And it's more important than ever, because we're not necessarily getting that same support everywhere traditionally we might have gotten that with some of these past epidemics that we've had. And so it's really important what you said about us being the trusted source of information, to keep it simple for people not to panic and to ignore the misinformation that's out there. And if in doubt, refer to the county health department, county web pages, official county communications is going to be so important moving forward. So excellent points. Dr. Gloria, did you want to close with anything?
Yes, if I may add to that, I think in public health we realize that basically to do a good job at our work, people have to trust us. Behind the scenes all the time, we tell people we don't want you to go out. We don't want you to do this. We want you to tell us this. We're finding out information. And it's very important. So we have really worked hard to develop trust. That's why we engage with our community all the time. Our outreach team is busy. We're always in the community, bringing them into our office, and more importantly, going to them, learning about them, understanding them, letting them know that we are there for them. And why that is important is that as we become more diverse, many of us are coming from countries where you cannot trust government. Mm-hmm. And so in times like this, it's very important that we are seen as a trusted source, and that we spend countless hours in what we call peacetime to really develop those relationships and build that trust, so that now, through the leaders that we have established relationship with, they are able to deliver our messaging for us through the networks. And it's a really, when you get to know a community, they have their networks, and it makes our lives and our work very easy, because they do the rest of the work for us.
Thank you.
Thank you very much. And again, thank you all for your participation today, and also for the show of force that we had on Sunday. I think the fact that we had that press conference on Sunday afternoon was driven by events that occurred that we needed to report facts on, but also was a demonstration to show the public that our folks are working around the clock on this 24/7 to monitor the situation and give us the best, most reliable information about an ever-evolving challenge. And so our boots on the ground are there, our intelligence is there, and we will continue to report out information as we know it and keep the public informed.